Hello, my name is Chris Bustos, and I will be doing the evaluation for tracheostomy suctioning. And the equipment I'm going to be using is my sterile field kit, normal saline, clean gloves, inner cannula, hydrogen peroxide, Q-tips, gauze, and this drain sponge. Before I get started, I'll be doing the 7 steps, which is check the physician's order, wash my hands, introduce myself to the patient, ID the patient, provide for privacy, organize my equipment, and
everything sounds good.
Explain the procedure to the patient. Now,
next I'm gonna
before I get started, I will raise
sterile dressing,
the bed to working height, and then set the bed to semi-Fowler's position.
up. I'm gonna put saline solution. I'm gonna check the date, make sure the label's away, pour it into the cup.
Once I get the patient to semi-Fowler's position, I will auscultate
my sterile
his or her lungs.
gloves. You should probably suck. You didn't check the suction. Check the suction. It's supposed to be right before. Yeah, you're right. Before I come
I will
to the
check
dressing.
lung sounds in all
You
fields.
can just tell me to stop. You don't have to say probably.
Well,
stop.
And
I didn't know
if
if
he
it would be
could
a huge problem.
lean
if
forward
you
for
opened
me,
that up
I
and
could
then you remember to go back.
No, 'cause I already
ask
had it
him to lean forward so that I could auscultate his posterior. But if he can't, I would
No,
roll
I
him
know.
over
Mine were. They're not even
and
over.
auscultate his lungs from there
All right. No, thanks, James. That's fine.
in all fields. And I will note any
I know. I don't want to do it again either. But at least
any lung sounds
I know it's annoying.
that may be
I mean,
abnormal.
we're getting it early today, so if you
Yeah. Either way,
Right.
because either way we're getting out.
Now I'm going to open my
Forgot about that.
suction kit, which is sterile.
Ready? Hi, my name is Adam Segal.
I'll remove
Today I'll be doing tracheostomy
my cup
care with suctioning. I just washed my hands. I went over the
and
7
then
steps of patient
take my
care.
normal saline, check the date on it,
Patient.
and
I'm
pour
going
it
to
in
check the wristband,
to the cup.
the ID to confirm that it's the correct patient.
Now I put my
Next,
sterile
we're gonna
gloves
do
on.
the raised bed, the level of safe working height, and also the head of the bed for the patient. Now I'm going to auscultate.
I will take the suction catheter.
Everything sounds good.
Right
Next
around
up,
my
I'm
hands.
going to check the suction on the machine. Kink the tubing, turn
Check-
it on.
Check the
See if
suction on
pressure
the
goes up
machine,
over 100. Seems to be working.
and of course it's working.
Next, I'm
Connect
gonna
the
come over
two,
here and open my
just like
sterile
that.
dressings.
Now one hand is clean, one hand is sterile. I'll check for pansy with the suction
I'm
by
gonna
dipping
take,
it into the saline cup,
saline, check the date, make
And-
sure
and-
the label's out,
intermittently sucking on it,
pour it into the cup.
and then remove his
Next, I'm going to don
O2
sterile gloves.
with my clean hand, and I would give him oxygen prior to the procedure to make sure that he has enough oxygen. Now I insert the catheter into the tube without suctioning until I meet resistance. Once I meet
Wish they
resistance,
had a bigger
then
size.
I will start intermittently suctioning
Possibly a thumb,
his trach.
but since I'm still inside, I'm still good.
And I'll clear it out with the saline again, intermittently. And I'll be noting any secretions, the color, consistency, maybe any odors. And I'll suction again.
Next, I'm going to take
and go all the way down until we meet resistance.
catheter, rather.
And then start intermittently suctioning again.
The suction.
Once I'm done with that, I'll disconnect it, shut off the machine,
Going to remove the ventilator.
throw this into the garbage can that I have, the garbage bag that I have taped to the table,
You suction by closing the hole.
and then
Turn the machine back on.
I'll remove his dressing.
I'm going to dip it in the saline to make sure patency and suctioning.
I'll remove his whole dressing,
Nice, I'm
throw it
good.
onto the garbage,
Put it down to the trachea
throw out the cup,
until I meet resistance.
and I would remove the sterile gloves
And now I'm going to start
and
suctioning
throw these away too.
and moving it around. Making sure that the patient is still somewhat comfortable. Getting mute this up.
Now I'll put on the clean gloves.
Go back. Put it into the saline. Go down one more time.
Take my inner cannula, the new one, making sure that the size is the same as the one he has. Open it up.
Okay,
Remove
good.
the old one. Throw it into the
Shut the
garbage.
machine off.
Grab the new one by the
Disconnect.
wings. And making sure not to touch the rest of it to prevent
The
contaminating it.
dressing off.
Place the new one on and lock it into
I'm
place.
going to dispose this into the garbage.
I will now take my saline.
You can
It'll
wash your
be
hands if you
half
want.
saline, half hydrogen peroxide.
Take my new regular
Open
new
up.
pair of gloves.
My Q-tips.
These gloves fit a little bit better.
Dip it into
than
the mixture.
One size fits all of sterile
And
gloves.
swipe the bottom to clean the stoma.
Now I'm going to open a new inner cannula, as well as
Get a second
Q-tips.
Q-tip
my 4x4s
and clean the other side.
and a new trach gauze. So I'm going to open up a new one.
While I'm doing this, I'll be noting for any infection, redness, any other
Yeah.
abnormal characteristics of the
Hold it
stoma.
by right here
I'll
by the
take
wings.
gauze and dry the stoma.
I'm going to pinch the old one. Remove.
Do it again for the other side.
And slide the new one into place until it locks down.
From here,
Now
I'll grab
we
the drain
go over
sponge
and do a half solution of saline
and replace the dressing that I
and half part
initially
hydrogen
threw away.
peroxide. And now we're going to clean around the stoma.
Now, once I'm done with that, throw on my gloves and auscultate. Oh, and while I'm suctioning, I would also be making sure the patient is comfortable, and
Dip into
if
the
he needs
solution.
oxygen, I would provide him with more before continuing.
Grab
I'll listen to
gauze.
his lungs again in all
I'm
fields.
going to clean around the stoma, inspecting it, looking to make
Also
sure it's
the
not
back.
red, swollen, infected, etchided. I'm going to wipe. Take
Replace his
one more
O2
gauze, dip. Finish cleaning
bed rails up,
and wipe.
bed back down, and then I would document
Now I'm going to
how the patient tolerated the
put the
procedure.
ventilator back in. Take my gloves off.
How the procedure went, the characteristics
Make sure
of
the patient
the secretions,
breathing all right. Assess him again. I'm going to oscillate one more time.
Redness or swelling around the stoma,
You didn't put the new dressing on.
and I will leave the call bell
Before
next to
I
me before I
actually
leave the room
auscultate, I
and wash my hands.
put the new dressing on.